একটা ভাল খবর অ্যাপেক্স ডায়াগনস্টিক ক্লিনিক অরো রিসার্চ সেন্টার ডিমাপুরে ইন-হাউস হিস্টোপ্যাথোলজি biopsy facility inaugurate করেছে diagnostic services expand করিগিনা apex diagnostic clinic and research center do one stop diagnostic center আছে সব diagnostic facilities আৰু services দিগিনা IB details about reporter adona lokode
HornbillTV इटे apex diagnostic clinic and research center पुराना बाजार डिमापुर ते आइन आसे मनुला लाइफ ते एकता बीमार साइसी बोले अलग अलग बीमार ताकि जाबे मान दिखि पाए इतु बीमार कान एकता जगह पर सबो बोले तो इतु apex diagnostic clinic भी एकता one stop center आसे याते अलग अलग डिपार्टमेंट स्पेशलिस्ट रखिगिना अपनी अनके इतु सर्विस दिबले लगा आइबी আজি इतु ला क्लिनिक ऑपरेटिव मान डिटेल्स याते की फैसिलिटीज सर्विस दिया से आरो मान पेशेंट्स कान के फैसिलिटीज दिया से इतु ला ऑपरेटिव मान इतु apex diagnostic clinic and research center laga मान याते डॉक्टर्स कान स्पेशलिस्ट कान लगते কথা কৰিগিনা याते क्लिनिक ते आइसु बोले की फायदा पाबो इतु अपनी अनके दिखाई दिबो आइबी तो इटा मोर लोते इटु apex diagnostic clinic and research center laga managing director ase taitu radiologist bi ase Dr. Worsham mogan ke join kui dia gane bishi thanks apni mogan Hornbill TV gan aji apna la center te aigena itu apna la research center te ki facilities noilebi service dia ase.
Thank you so much. Thank you Hornbill TV for coming here. We're privileged to have you here. Okay, so apex Diagnostic Clinic and Research Center. This is a diagnostic center where we have all kinds of diagnostic facilities under one roof. This was established on 14th of April 2022, 4 years ago. In this clinic, we have in-house microbiologist, pathologist, and radiologist. So that makes us a complete diagnostic center. So briefly telling about this diagnostic center, we started in a humble facility, but today we are able to provide all kinds of diagnostic facilities such as CT scan, ultrasound, echo, mammography, X-ray, HSG, and coming to lab, we have culture and sensitivity, fungal study, and then we also have all kinds of routine blood tests, and also we do higher tests, hormone tests, tumor markers, FNSC, and we also have ultrasound guided and CT guided FNSC and biopsy. So we are, I can say that we have almost all facilities in this clinic. And what makes us special, I will just tell a few points. See, many a times in our practice, a clinician or a referring doctor, they need to discuss about the patient's report or about the patient. So since we have in-house doctors, we have microbiologists, pathologists, and radiologists. So we can discuss about that problem, and it happens many times. And we try to solve the problem for the benefit of the patients. So that's briefly about our clinic. Thank you.
तो सर साइसी बोले तो diagnostic clinic centers can be डिमापुर ते एकला नय कोहिमा मोकक चुंगान भी इते तो numbers of clinic भी आसे तो compare करिसे बोले comparison तो करिवले बनाय होली भी ताइगान ला clinic और अपना ला clinic what makes key differences आसे और अपना ला clinic ते आइसे बोले तो what is the advantages?
Okay, first of all, we are also just another diagnostic center. Everybody is same. We're all doing our business. We're all trying to help the society and the patients. So, like I said, our USP is we are based on clinical medicine. We try to correlate always with clinical findings. We are not just men behind the screen or women behind the screen. We always call back the doctors, or we if needed, we even call back the patients, take histories, and then we try to correlate. And I would say we are not inhuman machineries. we try to correlate everything, and then we try to give our best report. That makes us a little bit different. Thank you.
As a radiologist, apni la itu radiology la department bi alop koi dibo, public an bi alop jani bole mun takibo. Apni la radiology department de ki hoy ase, ki ase, itu la bi alop koi dibo.
Okay, thank you again. So in radiology, we have 32 slice CT scan. We are doing regular cases. We get referrals from different kinds of hospitals and doctors and clinics. And also, one thing I want to stress is we also have mammography, where it is a machine to detect early breast cancer. So we are doing very good mammography. We correlate with ultrasound, and then we give out the report. And then we also do all kinds of X-ray, and there is something called HSG that is used for investigation of infertility. So we are also doing a very good HSG in our clinic. And also we have, echocardiography, and then we have ECG. And also we do a lot of interventional procedures. Interventional procedures in the sense we take help of the ultrasound and CT scan and locate the disease. And then we pass through a small needle, and then we take the sample from the exact location of the disease. That is called as ultrasound-guided FNSC or biopsy. And also we do pictal drainages, where there are abscess inside the abdomen, inside the liver. Then we put a small pipe and then drain it out with the help of ultrasound and CT scan. Thank you.
Doctors kan lo de interview lo do takan do sob procedure koi de to bisi detail ra koi dise. Anyway, I see ekta aro add koi diule bondo. Private hospitals, clinic chaise wele do charges bisi wala bi hinika bi bisi koi. Itu to government hospital ke compare korna paro hili bi ine jani bole bondo apna la charges fees kan bi kinika structures kan bi kinika se alop apni share koi dibo parile.
Yeah, okay. So I will say that we are very understanding about the rate issue. So we try not to go beyond the market. I will say we are comparatively okay compared with our parallel labs and then parallel hospitals. The rate is good rate we are giving. We are never going above the market rate.
Thank you so much for joining us. Thank you. So, itia mon yate Apex Diagnostic Clinic and Research Center te aigena itia mon itu radiologist doctor ke bi koda koi loise itu la research center opor. Olibi itia duita department bi ase aro itu laga opor te bi mon aro department de takana details bi kinika ase itu bi mon apnan ke doctor duita logode interaction korina itu details bi dikhai dibai bi. तो मोइगान इतिया यते लैब ते गुसिबो यते पैथोलॉजी डिपार्टमेंट ला लैब आसे तो इतु पैथोलॉजी डिपार्टमेंट ते की फैसिलिटीज सर्विस दिया से इतु भी मान डिटेल्स जानिबो यते डॉक्टर आसे ताइ लगते एकता दुटा इंटरेक्शन करिगना इतु लगा सर्विस सपोर्ट भी मान हुदिलबो तो यते गुड इवनिंग तो इटा मान लते पैथोलॉजिस्ट आसे तो एक बार मान अपनी ला डिपार्टमेंट इतु पैथोलॉजी डिपार्टमेंट लगा की facilities are service kan ki ase to mon ge koi
First of all, thank you Hornbill TV for having me. I am Dr. Handeshan Hovang. I am the in-house pathologist in Apex Diagnostic Center Dimapur. So here in Apex, we are doing comprehensive hematological studies, which includes all sorts of blood tests. In addition to that, we are also doing clinical pathology, which includes the examination of the body fluids like the pleural fluid, ascitic fluid, Pap smear, semen analysis, and urine cytology. We also do fine needle aspiration cytology, which is a very minimal invasive diagnostic test as well as screening test. Apart from this, we are also doing routine biochemical tests like liver function test, kidney function test, diabetes care, and then lipid profile. So apart from that, we are doing a very important extended test for tumor markers, which with the help of a highly automated, highly precision machine called Vitek, where we perform tests like tumor markers such as PSA, CA, CA125, LH, this one FSH and AMH and all, and so on. So incorporating all these tests, whenever we find any abnormal findings or any error, we or say I promptly reviewed it and we communicate with the treating physician. That's the good thing that we Apex are doing this. And also on this day, that is the 14th of April, I'm pleased to announce that we are launching a in-house histopathology section. As far as I'm concerned, or say, correct me if I'm wrong, that this might be the first in Dimapur private setup where this histopathology section will be, this will be the first, leaving aside the hospital setup. So earlier what we do is whenever we receive a tissue sample from various centers, we send outside Nagaland, which takes longer duration for the report. But now that we have in Apex, it will reduce the number of days will reduce by significant number of days. So that will benefit the treating physicians, but most importantly to the patient.
तो एकटा क्वेश्चन हुदी दिबो इतु तो आउट ऑफ कॉन्टेक्स्ट हो पारे नागालैंड तो ड्राई स्टेट আছে লিভার और किडनी ला पेशेंट गान किमान है
It comes on daily basis. Liver, especially liver disease.
যদি ইয়াতে আইসি গলে তো ইতু স্পেশালি লিভার কান লাগা চেকআপ করা কান কিনিকা আছে
That is mainly sent by the treating physicians, but sometimes they come by themselves. So we recommend them to go for master health checkup first, or say with specific to the liver test. So if we find any, what we do is if we find any derangement in the liver function, we consult the patient and also we communicate with the treating physicians. That's the thing we at Apex are doing.
Thank you so much. Apni la out of context ase hoile bi ine liver or kidney la check up kuri ko kha karne itu alop add kuri dala ase to anyway ita mon itu microbiologist lo de mon jaina tagan ki facilities tagan bi dia ase itu mon yate doctor bi ase tai lote interact ko
Acha, first to thank you for giving me this opportunity. Makan, we at the Apex, we are doing advanced culture and sensitivity. We are processing samples like blood, sputum, urine, body fluid, pus, and for ICU patient, we are processing catheters, CVC line, PIC line. Besides this, we are also doing OT culture and dialysis water culture, which is an important test for maintaining a standard OT and dialysis unit. We also have TrueNet PCR, and we are doing HIV, hepatitis B, hepatitis C, tuberculosis, and HPV with this machine. And among these 5 tests, except the HPV, all the rest of the tests comes with a viral or bacterial load. मतलब इतो टेस्ट टू पॉजिटिव ना नेगेटिव इतो हे नय हलबि तो लगा गाउदे इतिया पोका दो किमान आसे ना इतो बि रिपोर्ट ते आहि जाबो आरो we are doing a good fungal study also. Fungal study de KOH koina ekta thake test ito do from any sample mohan ito sample de fungus ase na nai ito janibo pare. Aro dusra useful test ekta do India Ink for Cryptococcus itu hoy ase itu do immunity khan down eneka khan thakadam de bimar hole dorkar hobo pare aro moi itu duita do kile first ko ase bole itu duita do mohan immediately report dibo pare aro itu he noi na mohan fungal culture bi kore ase ate fungal culture le do we will grow the fungus and after that we will identify and give the report. But for few higher fungal studies, we are referring to Advanced Microbiology Center and Diagnostic and Referral Research Center, AMC Dibugar. Aru itu enoi namuhan ekta study course pi run kore ase, certificate course, CMLT course, certificate course in medical laboratory technician. Itu do muhan in collaboration with NECU. Itu mohan kile start korise koile do mohala unemployed youth bishit ase etya to edu han ge training digena local talent khange mohan like employable banabo karne itu angle bara itu course to be ekta chotu course cholai ase
Ma'am, একটা question add কৰি দিব আপুনি লা এতিয়া Apex Diagnostic Center টাইমিং টো কিনেকা আছে 24/7 আছে না কিনেকা আছে
এইটো টাইমিংটো মহান 8 পৰা যাইকিনা 6 তক চেম্পলটো কালেকশ্যন কৰে ছামাৰ খানদেটো আৰু উইণ্টাৰদেটো 8 পৰা যাইকিনা 5 PM তক ছানডেটো অফ আছে মহলাটো এতিয়া কাৰণেতো
Thank you so much for joining us. তো এইটো আছে Apex Diagnostic Clinic and Research Center লাগা মান ইয়াতে আইনা ইয়াতে সেন্টাৰতে কি ফেসিলিটিজ সার্ভিস দিয়া আছে ইটো মান জানি লৈছে এতিয়া আজি 14 এপ্রিল তে তাগান লাগা ফাউন্ডেশন ডে বি কো পারবো অ্যানিভার্সারি কো পারবো তো তান ইটো আজি তান 4th year তান ইটো সেলিব্রেট কৰিবলৈ আছে তো ইটো সেলিব্রেশন লাভে মান এতিয়া অলপ কাটাবৰা ডিটেইলস চাই লও
Firstly, I'm extremely happy to know that Apex Diagnostics is officially launching the first ever in-house histopathology for biopsy on their 4th Foundation Day, signifying their dedication and commitment in providing the best healthcare and diagnostic services to the people of Nagaland. So congratulations to everyone involved for this.
Thank you so much.
With a lot of cancer cases that's been on the rise in our state, such as the nasopharyngeal cancers, stomach cancers, and the esophageal cancers in males, and likewise breast cancers, cervical cancers, and stomach cancers in females, delay in early diagnosis and treatment have compounded the health issues. As per the ICMR, National Center for Disease Informatics and Research, cancer ranks among the top 5 leading causes of deaths in our state, that is Nagaland. The causes of cancers are varied. For like example, there's environmental factors, there is dietary and lifestyle factors, we have genetic factors, we have infectious factors like human papilloma viruses, hepatitis B and C, age-related factors that causes the mutations in the cells due to old age. All these factors predisposes a person to develop mutation or changes in the cells causing cancer. We say that prevention is better than cure in our health context, but when it comes to cancer, there's not much that we can do about it. Or albeit there are some like modification of our lifestyle, avoiding the consumption of tobaccos, and vaccinations against cancer-causing viruses like hepatitis B and human papilloma viruses, for which the government has recently launched the HPV campaign. In cancer-related aspect, assessment of oneself and seeking early medical care is very vital. So with this launch of in-house histopathology at Apex Diagnostics, I'm very much grateful to ma'am and Dr. Warshim sir for making diagnosis more convenient and expedient for the people of Nagaland. I have worked under sir in my capacity as medical officer before I joined the civil services, and I have seen the level of dedication and sincerity of our sir. His reporting on imaging diagnostics by far has been the best that I have witnessed in terms of accuracy, in terms of precision, and hence the reliability. Another most common concerns of patients are the treatment costs. And what I've noticed here is that the rates here at Apex Diagnostics are quite reasonable compared to other labs and diagnostic centers, which addresses most of their concerns. Thirdly, during my practice here as MO, one notable quality that I have observed and appreciated is the soft skills and the level of professionalism of our staffs here in Apex Diagnostics. Therefore, I would like to encourage the staffs here to continue to do good and to never think that your work or your service goes unnoticed. Politeness and kind words are very important for the patients, and it goes a long way for us as a healthcare professionals. Lastly, I'm very proud to say that I was a part of Apex Diagnostics family that contributes to the needs of thousands of Naga people's health and welfare each year. I'm also very much excited with the upgradation of facilities each year. Last year it was mammography, and this year it is histopathology, biopsy facility. I hope and I'm sure that it will benefit a lot of people.